Hello, and welcome back to the Dealing with Diabetes series. Today we are going to take a little bit closer look at some of the more common types of diabetes. I'm Coach Jessica. Thank you so much for joining me. Now, as a review, if you haven't already done so, please go back and watch my vocabulary of diabetes video. It was the first one in this series, and it is going to help you understand some of the words that we're going to be using a lot in this video. I'm not going to go back and redefine them if we've already done that in the first video. So make sure you go back and watch that. So diabetes, as of January of 2022, this year, the CDC reports that over 37.3 million people in the U.S. have diabetes. Now, 28.7 million of those people have actually been diagnosed with it, but that means that there's 8.5 million people who don't even know they have it. Now, we're going to start with type 1 diabetes. That is the first type of diabetes, and it is formerly known as juvenile diabetes. Now, I was diagnosed with type 1 diabetes when I think I was 8 years old, and it is an autoimmune disease. Basically, what happens is the immune system mistakes healthy tissue or body parts for an invading illness or pathogen and attacks itself. And in type 1 diabetes, a genetic predisposition combined with a stressor or illness, in my case it was chickenpox, triggers the immune system to attack the insulin-producing beta cells on the pancreas. And this is a picture that I had on the previous video, but this kind of shows what happens in the pathogenesis of type 1 diabetes. Now, some signs and symptoms of type 1 diabetes. So if you or your child or anyone you know is experiencing these, it's a really good idea to have them checked out by a medical professional or have their blood sugar checked. Weight loss, frequent urination, irritability, blurry vision, fruity breath. One that's not on here but is also very common is insatiable hunger. If they're just eating all the time and losing weight, that's a pretty good sign that something is wrong. It is less common than other forms of diabetes. Only about 5 to 10% of all our cases are type 1. And it is most common in people under the age of 30. Now, there's a couple ways there's really one primary way to treat type 1 diabetes, and that's with exogenous insulin. Exogenous means outside the body. So one of two ways you can get that exogenous insulin, either with injections of a combination of basal, which is long-acting or background insulin, and bolus, or short-acting insulin that you take with food. Now, the basal insulins usually stay in your body between 8 and 48 hours. So common types of basal insulins are Basaglar, Toujeo, Lantus, Levemir, Tresiba, and then common bolus insulins. Now again, bolus means you're taking it when you're eating food, primarily carbohydrates. It's Novolog, Humalog, and Apidra. Those are the most common forms. Now, if you don't want to deal with insulin injections as a type 1 diabetic or any other type of diabetic, you can get an insulin pump. And these are pretty cool. I used to have one. It just currently isn't working for my lifestyle and the way that I eat. So I switched back to injections. But the insulin pump just delivers a constant, steady stream, usually of the bolus insulins, and it keeps your blood sugar more stable. And it allows you to kind of make changes on the fly, which is nice. So moving on to type 2 diabetes. What is it exactly? Well, it is the most common form of diabetes. Between 90 and 95% of all cases are type 2 diabetes, and it is progressive, often starts to happen long before the diagnosis is made. Remember 8.7 or 8.3, I forget how many, but like there are over 8 million people with diabetes who don't know they have it. Usually they're in the earlier stages of it and they just haven't realized it yet. Risk factors for type 2 diabetes, a family history of diabetes, and Age is most common in those over the age of 30, but it can happen at any age, especially in children who are severely overweight or obese. And with the rise in overweight and obesity in our country, it's becoming much more common to be diagnosed with type 2 diabetes very young. And that overweight and obesity combined with a genetic predisposition, also a sedentary lifestyle, and it is more common in people of color. But again, it can happen to anyone. So the most common way to treat type 2 diabetes, usually we start with the oral medications. And I'm going to do my best to pronounce these correctly. I apologize in advance if I don't. Metformin is usually the first medication that's prescribed, and it works by lowering glucose production in the liver and helps improve insulin sensitivity. Sulfonylureas, let me try this again. Sulfonylureas and glinides. They help the body excrete more insulin. Glinides are faster, but they don't act as long. This is a fun one. Let me see if I can do this. Thiazolidinediones. There we go. What they do is they help improve insulin sensitivity. DDP4 inhibitors help have a modest blood sugar lowering effect. GLP-1 receptor agonists help slow your digestion, and that helps lower blood sugar levels. SGLT2 inhibitors, they work on the kidneys to stop them from returning glucose to the bloodstream. Now, all of them have pros, cons, and side effects, so make sure you talk to your doctor about the side effects of each one of these before you start taking them. And some of them aren't appropriate for all different types of diabetes. Now, your doctor may want you to use insulin, and they also may suggest bariatric or weight loss surgery for treating type 2 diabetes. Now, there is a third type of diabetes, and I decided to put this in here because I have seen several people, and I've worked with several people who are misdiagnosed with type 2 diabetes, but what they actually had was type 1.5 diabetes, which is otherwise known as latent autoimmune diabetes in adults, or of adulthood, also known as type 1.5. And the thing with this one is it has characteristics of both type 1 diabetes and type 2 diabetes. And about 2 to 15% of all adults diagnosed with diabetes have LADA. That's another way we call it, another thing we call it. Now, generally the characteristics of LADA are an older age of onset than type 1 diabetes. Usually it's in people over the age of 30. Generally, they have a higher body mass index than those with type 1 diabetes. They're probably not losing huge amounts of weight and looking skeletal like children with type 1 diabetes might, but they also are going to have a lower body mass index than those with type 2 diabetes, which again is more common in people with higher body weight. They do have insulin resistance, and they have a faster declining C-peptide than those with type 2 diabetes. Now let's talk about C-peptide a little bit, because C-peptide is a byproduct of insulin production in your body. And what it is a blood test that indicates a low level of C-peptide will indicate low insulin production. And there are a lot of other factors at play, so usually you're not going to get diagnosed with LADA by just your C-peptide test alone. In order to get a diagnosis, you're going to have a test of autoimmunity to one or more of the following antibodies: ICA, GAD, IA2, and IAA. Now, what those stand for, let me look at my notes because I don't have them memorized. Islet cell autoantibodies, glutamic acid decarboxylase autoantibodies. IA2 is tyrosine phosphate-related islet antigen 2. And IAA is insulin autoantibodies. So a lot of those words sound like things we talk about with diabetes, and your body is in LADA. You're going to have antibodies to these, some of these, or maybe all of them, or maybe just one of them, and that helps diagnose LADA. Now keep in mind that LADA is actually a fairly recent discovery. In fact, I spoke to a doctor the other day who had never even heard of it, and at first he didn't believe me that it existed. So I had to show him some science and some studies that talked about what it was. So now he knows. But some doctors might not even be aware of it, which is a lot of times why people are misdiagnosed with type 2 diabetes. Now, in this case, what tends to happen is they are diagnosed with type 2 diabetes, and then they put them on oral medications only. They give them metformin or a couple of the other ones. And then as time goes on, their beta cells are getting destroyed by the autoimmune process, and those medications either stop working or they're not working as well, which causes higher levels of hyperglycemia, and you might start to see complications. Doctors will say, hey, are you following what you're supposed to be doing? Are you taking your medication? Yeah, I am taking it, but it's not working. Well, maybe then you need to ask for the blood test to check to see if you have LADA. Now, here's some treatments that are important for all types of diabetes. Blood glucose monitoring. This is crucial. It doesn't matter if you're type 1, type 2, LADA, you need to know what your blood sugar is doing. There's a couple different ways you can do this, either with a finger stick like you're seeing in this picture, or you can use a continuous glucose monitor. These are called CGMs. The one on top is the one that I've used before. It's a Dexcom. It's actually, I love the Dexcom. I don't get paid anything for mentioning them, but they're one of the two primary providers of continuous glucose monitoring. The one on the bottom is the Libre. That's the one most often used by type 2 diabetics. It's not exactly a continuous glucose monitor, but it's much easier to monitor your blood sugar with that. You don't have to do the finger stick. You just wave the reader across it, and it tells you what your blood sugar is. And of course, nutrition. Nutrition. This is so important. I'm not going to talk about that in this video because next week we're going to get into nutrition for diabetics. And of course, exercise. Physical activity has a lot of keys. It helps reduce body weight and chronic inflammation. It improves blood sugar control. It improves insulin sensitivity. It improves mental health and depression. And it improves your overall cardiovascular health. So get out there, get moving. And exercise may reduce your medication needs, so make sure you work closely with your doctor to keep things monitored. I don't want your blood sugar to crash. So if you have any questions, put them below. Also, please don't forget to leave me a review. Give me some stars. 5 stars are always appreciated. And make me your favorite so that you don't miss the next videos. Next week, we're going to get into how to eat if you have diabetes. And with this, it really doesn't matter what type you have. The things that I'm going to talk about are going to help you regardless of your type. And of course, you can reach out to me through my business, Total Health and Fitness. So hit me up, jessica.tucker@totalhealthandfitness.co, or my website, www.totalhealthandfitness.co, not .com. And if you need more information about diabetes, if you have a type that we didn't cover, I'd be happy to talk to you about it, give you some more information as well. And here are my references. And thank you so much for joining me. See you next week.